Welcome back. Tonight, we're taking on a serious condition that can cause significant medical problems if not treated. It's called PAD, or Peripheral Artery Disease, and it can lead from difficulty walking to an amputation. But luckily, we have an expert here, Dr. Brian Evans with Comprehensive Integrated Care, to break this down. PAD, Dr. Evans, what is it, and why is it often called the silent killer?
Well, thank you for having me. PAD, peripheral artery disease, is the buildup of plaque on the inside of the arteries. Not only does it happen in the arteries that are going into your legs, but it happens in the arteries throughout your body. So arteries of your heart are the ones that are going up to your head. So when you start developing symptoms of PAD in your legs, which can be pain walking short distances, rest pain where you're sitting down or lying down, pain at night, or wounds on your feet that just aren't healing, that is an indication that this is happening and is happening throughout your body. Could lead to strokes or heart attacks. So it's something that should definitely be evaluated as soon as those symptoms are occurring.
It sounds like if someone at home is dealing with that, they know about it. It's a pretty painful condition. So what do doctors like you do to treat it?
So in terms of treating it, there's multiple ways of doing it. It's medical management. There are some medications that can help. It can be lifestyle modification, stop smoking, exercising more, moving more, using your body more. And if none of those are helping, then we can improve the blood flow from the inside out. Through a small little nick in the upper thigh, we can get a little tool inside the arteries that feed the legs, and we're essentially fancy plumbers where we're cleaning the inside of those arteries out.
I don't know about our live studio audience and our viewers at home, but it's pretty amazing what medicine can do now non-invasively. I mean, to do that without having to really cut open is pretty amazing.
It is quite amazing. It's the way we are moving in medicine right now. So through a small little nick in the skin, we can do quite a large amount of work on the inside. And patients go home about an hour after the procedure. It's all done in an outpatient facility, and all you have is a little Band-Aid.
And it sounds like this is a pretty quick procedure, and so do people start seeing results as quickly as it's pretty much taken care of?
People can start seeing results right away. When we're treating patients with PAD and say they have a wound to their foot that hasn't been healing, once we improve that blood flow, they can see some drastic changes very quickly.
Wow. Dr. Evans, thank you so much. Anybody in our live studio audience have any questions about peripheral artery disease?
Does it affect both legs or just one? Can it affect both legs?
PAD can definitely affect both legs. The development of the plaque happens throughout the arteries in the body, so nothing is really spared, so it can definitely go into both legs. And in terms of swelling in the legs, PAD can lead to swelling if there's infection or something called cellulitis, which is an infection of the soft tissues of the leg. But when we really see a significant amount of swelling in the legs, it can be some sort of vascular flow issue, but more than likely it could be related to the veins in the legs.
Thank you so much for those great questions. Dr. Evans, thank you for coming on the show.